Okay, let's dive right into this explainer. And hey, I promise to keep this quick, well under 5 minutes, so we can get right to the good stuff. We're tackling a massive problem today. That chronic back pain and stiffness that, let's be honest, is probably sitting right there in your body as you watch this. Now, you've probably tried absolutely everything to fix it, maybe even buying one of those ridiculously expensive ergonomic chairs. But what if the solutions you've been given are actually making the whole problem worse?
Think about this. Right now, about 1 in 4 Americans suffers from back pain. It is literally the leading cause of disability worldwide. No joke. But despite all our advanced ergonomics, all those chiropractic adjustments, and modern physical therapy, the rates of chronic stiffness are just going up. So what if our modern solutions are completely missing the mark?
Section 1. The back pain epidemic.
See, we are facing a massive crisis of chronic stiffness, and it's driven entirely by the way we live today. Decades of sitting, screen time, and just gravity literally collapse the thoracic vertebrae in your upper back. And here's a crazy fact for you. For every single inch your head sits forward of your shoulders, you are adding 10 pounds of extra load to your cervical spine. That fundamentally changes your breathing, it compresses your lower back, and it signals your nervous system to guard itself. Your body isn't getting weaker, guys. Your tissue is actually getting shorter.
Section 2. Why static stretching fails.
So if you're dealing with this collapse, I bet you've been told to just stretch it out, right? But why do those traditional static stretches feel amazing for about 10 minutes, only to have the stiffness immediately bounce right back? Well, when you push a tightened lower back into static stretches, you aren't treating the root cause. You're just temporarily pulling at tissue that is absolutely desperate for a completely different kind of movement.
There is a core disconnect here between 2 totally different approaches. Western static stretching aggressively pulls apart tight muscles in fixed positions, which, really only offers temporary relief. But Eastern methods, specifically Shaolin and Qigong practices, well, they don't treat the body as isolated levers. Instead, they use rhythmic, wave-like movements to treat the entire connective tissue web, actually allowing the body to permanently remodel itself.
Section 3. The ancient movement solution.
Section 4. The science of fascia.
To really understand why this works, building upon 1,500 years of knowledge from Shaolin monks, who, by the way, faced the exact same bodily stiffness from long hours of seated meditation, we have to look at your fascia. Your connective tissue is kind of like a sponge. When unused, it gets brittle and just completely resists aggressive pulling. But when you apply the sustained, wave-like motion these monks developed, that tissue actually rehydrates. It stops recoiling and begins a permanent biological process called fascial remodeling. And get this, here is the magic number. It takes exactly 90 seconds of sustained tension for fascia to stop simply stretching and actually begin to permanently remodel. This isn't just a wild guess. This is a true tissue biology threshold mapped out by modern researchers. If you've been holding static stretches for 30 seconds and wondering why your posture hasn't changed, well, this is exactly why. You are entirely missing the remodeling threshold.
The clinical data backs this up beautifully too. Modern clinical protocols utilizing these Qigong and Shaolin methods demonstrate massive, measurable results. We're seeing a 10 to 15% reduction in disability, significant drops in the visual analog pain score, and major increases in lumbar range of motion. It really proves this isn't just ancient magic. It is profound, measurable biomechanics in action.
Section 5. Your daily healing practice.
Listen, your body isn't broken. It's really just guarding itself. So how do we signal safety? You do it by dedicating just minutes a day to targeted movements. Think things like the low Dragon Lunge to unglue the hip flexors that compress your lower back, or dropping into a deep squat hold. Then you can finish up with the standing wave to hydrate your entire fascial web. Doing this means you actually treat the source of the compression, not just the symptom. And honestly, the best part, it doesn't take hours. By adapting these protocols to short 20-minute sessions, specifically omitting those exhausting, higher-effort upper body movements like clenching fists with fierce eyes, anyone can reliably hit that 90-second fascial remodeling threshold. And you only need to do it just 3 times a week. No burning out, I promise.
Which brings us to our final thought. The body is ruthlessly efficient. It literally eliminates what you don't demand of it. The body keeps the bill. So the question I really want to leave you with today is this. Are you ready to stop temporarily treating the symptoms of your back pain and start asking your connective tissue to truly heal?